I'm Scott Miller, and today I am in Holland. See, yesterday I came from Norway, and tomorrow I leave for Sweden. Wherever I am talking about psychotherapy, the question is always the same, and that is, what does the research evidence say? More than ever before, the field is being asked to show that what they do actually does work. And the research evidence is really quite clear. Psychotherapy works. The average treated client, according to 40 years of outcome research, is better off than 80% of the untreated sample in most studies. Even though we can cite such research, however, we're being asked to also prove on a session-by-session, case-by-case basis that the work we do has value and merit, that the consumer is really getting what they came for, and that the payer is getting a value for the particular service that we're offering them. So what can we do? Well, we can formalize what good clinicians do the world round, and that is they monitor the service that they offer. Most of this has been done implicitly, with intuition. But there is a way to do this that also meets the demand for accountability, and that is to use some simple measurement tools to find out what's the status of our relationship. Does the client feel engaged by it, and are they making progress during the treatment that we're offering? If we formalize this process, use a simple measurement tool, for example, our team has pioneered the outcome rating scale, a simple measure of progress that can be used from session to session and client to client, and the SRS, or Alliance Measure, a scale that measures what's the quality of our connection that we have from session to session as well. If we can do that, we not only meet the demand for accountability, we can show that the work that we're doing with that individual client is actually helping, but we can also aggregate that data. We can show that we're effective practitioners overall with the majority of clients that we're working with. There are now over a dozen randomized clinical trials that show that when therapists formally monitor the outcome and the process of treatment, that is, progress in care and the status of the relationship, that outcomes improve as much as threefold. In addition, dropouts decrease. And most importantly, we catch client deterioration much more quickly, leading to a 66% decrease in client deterioration overall. Asking clinicians to do more during their sessions is asking quite a bit. We're already inundated with oversight and paperwork procedures. A lot of work just to meet with our clients. So it's really important that clinicians have a simple way to be able to monitor and measure the outcome of their care. The ORS and the SRS, available for free from my website at scottdmiller.com, are one way to do that. A second way is to use technology. For example, something like a smartphone. Think about having the client be able to provide feedback to you on an ongoing basis in our currently connected world. And that's what I'm lucky to be here to inaugurate here at the 1NP conference in Holland today. A smartphone application that clients can use when they meet with you to monitor both the status of the relationship and progress, providing you with instantaneous feedback about whether or not the client needs some extra help, what other kinds of strategies we can use to keep them engaged and moving forward. I know you'll be interested in this as we all work to meet the increasingly challenging atmosphere that we're working in the field of mental health. Thanks for listening.
Developing this new device, it was quite a challenge to find to coin a term that would do right to the essence of what it is. And we've chosen the name M2Fit as a match to the feedback improved therapy. And that's exactly what it is. It is a novel way to support feedback improved therapy. For all more information about this app and how to put it in use for your own practice, you can look up the internet address m2fit.com, and there you can find all the information you need.